Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
Well, according to the National Council on Aging, falls are the leading cause of fatal and non-fatal injuries for older Americans. Now, falls not only threaten a senior's safety, but also their independence.
However, falling does not have to be an inevitable part of aging. Fall prevention programs and clinical community partnerships can substantially reduce the number of falls among seniors. Here to discuss fall prevention is a member of the Olmsted County Rochester Falls Prevention Program, Dr. Connie Bogard, and accompanying her is Ms. Liz Brigham, who, after an injurious fall, has successfully taken part in evidence-based falls prevention programs. Welcome both of you to the program.
Thank
Hello.
you.
Dr. Bogard, Liz, great to have you.
Thank you.
So, Dr. Bogard, falls pretty common in the elderly, probably too common. And how do you explain that? Is it just getting older, more difficult to stay upright?
No. So there is a myth that says that people who are getting older fall. That is really an untrue myth. So there are usually reasons that people would fall as they get older. So there are risk factors such as a disease process. So someone who may have had a stroke, Parkinson's, that obviously puts them at greater risk. But there are other factors that include things like weakness, problems with balance, problems with gait, might be a deficiency in vitamin D. It might be things that are more extrinsic factors like environmental factors that could cause a fall. There may be lifestyle or habits that people use that might be more riskier habits as they get older. And part of it is that they may not have help, so they're doing it on their own, trying to be independent and maybe taking more riskier habits with their falls.
Liz is along with you, and we're talking about elderly people and seniors. And first of all, Liz, I'm not sure that you fall into that
You
category.
don't qualify,
I'm
Liz.
63 years old. I'm close.
Okay, well, but you experienced some falls. How many times did you fall, and what happened?
I fell 3 times in the matter of about 6 months, but I had had a heart-lung transplant and was sick for quite a while and was weakened. The first time I fell, I would say it's because I had inappropriate shoes, and they caused me to fall. The second time I fell, I was trying to get up a curb, and I tried to be independent and not have anything to help me, and I fell that time. And the third time I fell, I was in my own bathroom at home, and it was in the middle of the night, and I don't know what, I tripped getting off the stool and fell. And that time I broke my ribs, I had a black eye. It took my husband and I about an hour to be able to get me up.
These all sound like almost stereotypical falls that someone would experience when they're recovering or when they're older.
That's right. So again, falls can happen from a toilet, from slipping on a slippery surface, getting out of the shower, on a crack, going out on your sidewalk, bad shoes, a pet that's underfoot that you trip on, a carpet tear, a rug that's in the way. So there are so many, it's like multifactorial. And so for each person, you really need to look at their intrinsic, their own factors, the environmental factors, their habits, and pull all of those together to see who's at risk of falling.
Now, when you first came in, Liz, you said she's my coach. So, and as part of the fall prevention program, I would suspect that that's where the two of you met. That Dr. Bogard, you were Liz's coach. First of all, what does a coach do?
Well, actually, I actually have a health coach who referred me to this A Matter of Balance class that I took. And when I read what it was about, I said, that class is for me. And that's how I met Dr. Bogard here. And it was an 8-week session, half of it studying out of a book and half of it doing exercises. But I learned so much, mostly not to be afraid of falling. That was the most important part I got from that.
Over 8 weeks, that's what you stressed the most, Dr. Bogard?
Right. So there are evidence-based programs. One would be Matter of Balance. So that program runs for 8 weeks. It meets for 2 hours. It's educational and exercise-based. So Matter of Balance is one. Stepping On is another evidence-based program. SAIL, which is Stay Healthy and Independent for Life. And then there's also an exercise program called Tai Chi Quan, Moving for Better Balance. So these are evidence-based programs that you can get exercise, fitness, and education and they're rolled out in communities, so volunteers may teach them. I happen to be a volunteer coach for Matter of Balance.
Here
And they're all free.
Yeah, here in the Rochester area. But this program goes over 94 different radio stations all across the country. And so how do patients find a fall prevention program if they are in Arizona or Maine?
Right.
Or Washington.
So across the country, there are area agencies on aging in every state. And so getting a hold of your area agency on aging, they should be able to connect you, because there's a big push at present across the country to get evidence-based programs for fall prevention out into the community. Target those areas and really build on those. But the Area Agency on Aging is a great place to get that information.
So when you say evidence-based, what exactly does that mean?
So evidence-based means that they've studied it, they've looked at a population to see if you finish this program, does it decrease your fear of falling? Does it decrease your actual falls, prevent you from having to go into the hospital? So following individuals over time to see if that program really made an impact on their lives. So that's part of following those kind of programs.
I would have to think it's a little bit different, or maybe it's not at all if someone is elderly and just the course of, what aging does to you. Or in your case, Liz, when you are recovering from a major surgery, I mean, that is a hard thing to do, to recover. Never had to recover from heart and lung transplant, but I imagine that's tough too. So
It was tough because I was, in the course of that, I was weakened and sick and in and out of the hospital. I have learned that if you don't keep moving, you're going to lose it. When I came out of the hospital after one time, I couldn't walk. I was in a wheelchair, and it's taken me a year to learn how to walk again. But I say, you can't stop moving. You can't stop moving, because what happens to your body when you stop moving is trouble, and that makes your potential to fall so much greater. If you don't keep moving, keep exercising, keep using your muscles as much as you can.
that, of course, pertains to elderly people too then. They don't have to have had a surgery or something like that, just aging in general.
Right. So obviously staying fit. So if you become sedentary, you're not going to have that strength to be able to move yourself. So we really encourage people to get that ongoing exercise, 150 minutes a week of exercise, and that means both aerobic, balance training, and strengthening for older adults. So finding that in your community in terms of exercise programming is very critical.
Liz, you look fabulous, by the
thank
way.
you.
You
Thank
have had a heart and a double lung
Yes.
transplant? And how long ago was that?
December 13th, 2012.
Unbelievable.
December 10th, 2013.
Well, anyway, it's so good to have you here. So one other question, Dr. Bogard. Obviously we don't want people to fall, but what should you do if you fall down and you can't get up and there's nobody available?
Right. So part of this is planning ahead. All right. So knowing if I should fall, what should I have prepared ahead of time? So carrying a cell phone or have a life alert pendant that you're wearing. If you don't have a cell phone, have a cordless in a fanny pack that you're wearing so that you can call 911 to get assistance. But think about every room that you're in. If I should fall, what would I do? Is there a chair I could roll over, crawl to, drag myself to get to that chair that's sturdy enough that I can use it to help me get up? All right. So I think planning, preparation, can I get down to the floor and get back up? Maybe I practice that with someone that I love so I can at least, if I had to, do it. So many times older people don't get to the floor and they don't even know if they could get up if they do fall. So having a plan ahead is very important if you should fall. If you call someone, 911 versus if you're injured, knowing to do that right away versus trying to get a hold of a daughter or son to help you if you've been injured. Again, call 911. You can get a lift assist from fire department. Emergency medical will come transport you if you need to the emergency department.
Mayo Clinic physical therapy instructor, Dr. Connie Bogard, such great advice. Really appreciate you being here. And also Liz Brigham, don't fall again. You look
I won't.
fabulous.
Thank you.
Thanks
Thank you
also
very
for
much.
joining us.
Thank you.